Hello everyone. I am with one of the most skilled periodontists from Saudi Arabia, a hardworking tutor and educator, both certified periodontist and a working mother. So I think I need to stress this because it's very difficult in Saudi Arabia, especially to be a clinician and also a mother, especially when you're doing something towards surgery. And she's an amazing human being and a dear friend. Welcome, Dr. Dalia Noura.
Welcome, Dr. Salman. Thank you so much. I appreciate this introduction, and I'm really happy to be here with you today.
I'm really glad that you find time for this, and I know you're already completely busy for today, and you're actually catching a flight in the evening, and I'm really happy that you're doing this for me.
My pleasure. My pleasure. Thank you.
So, Dr. Dalia, how can we start? What type of questions should I ask you? For the most important thing, I want to ask you, what about implants? What do you think about implants?
Okay, I'm just going to start before that a little bit because I need really to submit a message. As you said, as a female, we're facing a lot of challenges. And then having this journey to learn about implant, it wasn't easy actually. But we can do it as a surgeon, especially in the surgical part. I need to stress that. So my journey started from US when I'm in academic. I'm in Al Qura University assistant professor. So as an academic sector, you have to take a scholarship. So I went to the Buffalo University, New York, and then I got my master's degree and clinical residency in perio and implant fellowship. So I took the American board and the Canadian board. Actually, I learned a lot, but always my message is you need to keep yourself updated and trained in the implant dentistry in order to improve yourself. We still lack a lot of information in implant dentistry. And then I think this is a very nice specialty that you can expand your knowledge a lot and keep updated.
There are a lot of perio guys, but there are very less good perio guys. I must say that because I personally love perio, but it's a tough job. I do understand. And being as a mother and how do you balance the personal and professional life?
Well, I'll be so honest. It's not a tough job. It's not easy. However, when you have a target and you prioritize your missions and just try to divide it step by step, and the most missing things that we're not asking for help, but you can ask the help from even your husband, the family, and you can balance between this and this. Now, if you want to try to find time, you will just put exactly the objective and then the goals that you need to reach and try as much as you can. You don't need to be perfect. Perfections is the enemy of the person, but always you try to do the best and balancing between this and this. And as I said, I have an academic sector already. We are improving ourselves continuously, and this is play a good roles. Online courses now and online lectures, even if you can't attend, it's amazing. And now there's a lot of channels that keep you updated. My private practice, it's a huge area even to learn and improve yourself. So by this, you can do it now. If you get like a baby or something, you might hold a little bit, but that doesn't mean you're not continuing, and you can catch up. You would catch up.
I think the best, if I want to just summarize this, it would be implant is completely about learning and learning process. So you have to just keep yourself updated, and there are lots of things which are coming. Also, I know that you're passionate about teaching, so I really envy the guys that you're teaching.
Well, it's a passion, as you said. It's a passion. Sometimes they told me how you're doing all this. I said
I asked you the same question, I suppose, many times. So, Dr. Dalia, how do you manage?
Well, if you're doing something from your heart, it will come up. It will. You will not feel that stress. You will not feel the time, even if you're sleeping not that too much hours, but you're enjoying this, and the rewarding to me, it's a lot. So
I've seen you. I've seen you because traveling from Jeddah to Mecca and coming back itself is a task, and hats off to you, doctor. You're doing a completely it's more of a service that you're providing to your peers, and it's not for everyone one. So I do understand. I'm a man. I do understand the situation you're in, because my wife, she's also a dentist and she's not working for the same reasons. And I do understand what the problems and challenges you face. And one more thing, a quick question. Any message for your peers?
Okay, so my message actually, don't give up. Keep going. Don't fear, because most of our fears, it's only in our minds. I learned a lesson that even yesterday I said it. Whatever challenges you have and a fear, it's just only in your mind. Just go through it and challenge yourself. You will be amazed how good you are and how capable you are to achieve this. You can always, I'll say to any person, you can do it. Don't be always in the comfort zone. Just go out to the ocean and really enjoy the journey, seriously.
And now we come to the more technical part. Like, I would like you to, which is your best graft? Like, which is your everyday graft?
Okay, actually, my daily practice graft is allograft. I like the allograft, and sometimes I mix allograft with the xenograft. In some cases, depends if you're doing layering technique, or it depends on what defect that I'm having in front of me.
Okay, and can you name 3 best implant systems?
Well,
It's a tricky one.
This is a tricky one. I would say I'm not going to name companies, but I say it always. Choose the implant that have a good surface treatment, the implant that have different sizes that will really help you in the practice, and choose the implant that has a lot of researches. It's well documented. There is a good solid background. Also ask the expertise about how the long term, because you might place the implant and you see it after 1 year, 2 years perfect, and then in the long term you see the complication. So once you had all that together, and you need to try, we'll document this is how you will choose your implant. Prosthetic part also, this is another story. Okay.
Also, what is the most important thing for a successful implant treatment?
Okay, there is, I would say, 3 things. So now the quality of the implant is important, and then as a surgeon, you have to have a skills, and then the patient selection of the case. You might be the best surgeon, and then you're placing the implant, patient not compliance, and they're not taking care. They're smokers, they uncontrolled diabetes, and then you're gonna have failures. So by having these 3 sectors, you will have absolutely a successful implant.
And what are the challenges you face in terms of patients? Like, because some of the patients are really misinformed. So how do you counter it? I know it's a irritating job, but how do you do it?
How to select my patient? Yeah. So I have rules actually when I'm selecting.
Oh my God, that's...
Well, actually, first of all, definitely I'm a periodontist. So if I have a pocket, I'm not going to place implants. We need to treat first. If we have a crowding or something, even if the patient, they say, I don't want to do it, I said, I'm not going to place the implant based exactly what you want, based on exact what you need. And do I see I need to do this or not? I know that patient autonomy is very important, but not all the time. You have to have your opinion as a clinician. And then if the patient smokes 2 packs, 1 pack, we need to stop this because it's going to affect me and my reputation later on. They will not say their fault, but it's your fault. So you need, even if there is any systemic diseases, just make sure it's controlled. Actually, I think this is our job to educate people, because you want to have I would say back and forth, like a collaboration between you and between your patients. Otherwise, it's a not one way treatment.
There's one more question I have. This is kind of, everyone wants to ask this, but no one is doing it. How do you treat failures? Because that's not your job. Implants which are placed outside that come to you and you can't do anything. Like sometimes you can't even think what should we do. So how is your take on this?
Okay, so well, I like actually to zoom out a little bit the problem, and then starting with education people. And I think my website, my already Instagram and the TikTok, and I'm working on such. Yes, it's more stressing in patient education because they don't know. Sometimes they go for a cheaper, or they travel outside just to get the cheaper, but then we are facing the complication. The second thing is actually you need to evaluate how severe is the problem. Don't go always and treat. Now, if we have a recession around the implant, it's not okay. This is, I would say, it's not successful, but it survived implant. You don't need actually always to correct everything. Prioritize the failures, and then you need to make sure that your patient is understanding the problem, and start step one by one. And if it's going beyond your skills and your capability, just stop and tell the patient. Sometimes you're pushing your limits, and you don't have to do that because it's not your fault. It's not your fault.
So I think the best option is to just make the patient understand first what's going on, because most of the patients are really uninformed about, and especially the dental tourism industry. They go to somewhere else, get there. Some of the systems are not available in the country, and I think that those are the challenges that everyone is facing. Just one more thing. What is the take-home message for you, like you want to give?
Okay, my take-home message, first of all, as I said, keep learning, keep update yourself, keep practicing, because the more you practice, the more you will see, the more you learn. Experience is really important. Don't tell me you're placing like single implants every day and you're experienced. No, you have to have a good experience. Improve yourself. Try really to educate your people, play a role on that. Just don't be passive in this community, and then don't forget yourself.
That's amazing message. That's amazing message. Absolutely, I agree with you. Thank you so much, Dr. Dayala, for doing this. It's amazing pleasure having you, and you're the first one actually that to interviews like for such a long time. Thank you so much, Dr. Dayala. It's an excellent.